Good morning, all. My study is titled Clinicopathological Patterns and Surgical Outcomes in Periocular Basal Cell Carcinoma, a retrospective study. Basal cell carcinoma is the most common malignant tumor of the eyelid worldwide, and BCC are slow-growing tumor, rarely metastasized, but can invade local tissues if left untreated. Wide surgical excision remains the primary treatment for BCC with intraoperative margin clearance. This is a clinical picture showing a firm pearly nodule measuring 5 mm into 2 mm on the upper lid of the left eye, and the lesion has rolled edges, focal cresting, and there is distortion of the lid margin and loss of eyelashes, which is highly suspicious of basal cell carcinoma. So the aim of my study is to analyze the clinical patterns, pathological subtypes, and management outcomes in patients with periocular basal cell carcinoma for better understanding and management of the disease. Materials and methodology. It's a retrospective observational study carried out from 2014 to 2025. We have included all patients who were histopathologically diagnosed with periocular basal cell carcinoma with complete clinical and histopathological documentations. These were the data collected. Moving on to the results, there were 17 patients who were histopathologically proven BCC with mean duration of symptoms of 3.22 years, with maximum follow-up period of 120 months and mean period of follow-up of 49.12 months. The mean age of presentation was 68.12 years, and there were no cases below the age of 40 years. In our study, there was a slight male predominance. At presentation, 15 out of the 17 patients presented with primary lesion, whereas 2 patients presented with recurrent lesions. Majority of the tumor measured less than 10 mm with a mean tumor dimension of 8.79 mm. Among the 17 patients analyzed, 100% of the patients had loss of lashes, 59% surface telangiectasia, 82% had rolled edges, and 94% had central ulceration. Lower lid was the most commonly affected anatomical site. Nodular type was the most common histopathological variant, and all the cases had pigmented basal cell carcinoma. Local invasion was seen in 4 out of the 17 patients, of which 1 case exhibited perineural invasion. Direct closure was possible in 23%, and larger defects required flaps 41%, grafts 18%, and combined flaps plus graft in 18% of the patients. Lower lid involvement was most commonly seen in females and upper eyelid in males, but it was not statistically significant. Nodular BCC was predominantly seen in male, but this was also not statistically significant. And nodular BCC was most commonly seen in lower eyelid and medial canthus, but was not statistically significant. Moving on to a case of 53-year-old female who status post-wide excision and rotational flap reconstruction in 2022 had presented with progressive increase in the size of the lesion. The first image shows a pre-operative picture showing a lesion on the medial canthus of the left eye, and the lesion had central ulceration and rolled pearly edges characteristic of rodent ulcer. Second image is the intraoperative picture showing excised BCC, leaving a full thickness defect which is reconstructed with local cutaneous and rotational flaps. And third image is the post-operative image of the patient at 2-month follow-up with well-positioned flap, healthy vascularity, and there was no flap congestion and necrosis. There was no recurrence at 9-month follow-up for this patient. Moving on to the discussion, mean age of presentation was 68.1 year, which shows that incidence increases with advancing age. No cases were seen below 40 years, which was consistent with the age-related risk pattern. The average duration of symptoms before presentation was 3.22 years, which shows delay in seeking medical care among patients, and late presenters were 76.47% who presented after 6 months after symptom onset. Lower eyelid was most common site, which can be due to greater UV exposure. 11.76% of the patients did not demonstrate the classic clinical features typically seen in this tumor. The most common histopathological type seen in our study was nodular BCC, which was in line with other studies. All cases were pigmented BCC reflecting higher prevalence in darker skin tones. Local invasion showed 1 case of perineural invasion, which is a rare but important indicator of aggressive basal cell carcinoma. Direct closure was limited to small defects, while larger periocular BCC mainly required flaps, grafts and flap plus graft in line with literature reporting flaps as the predominant reconstructive method. There were no significant association between sex, tumor site or histological subtype, and the recurrence was observed only in previously treated cases which can be linked to incomplete excision. There was complete tumor excision with 4 mm margin clearance achieved nil recurrence with a maximum follow-up period of 120 months and an average follow-up of 49.12 months. Our observation reveals that most evidence on periocular basal cell carcinoma comes from Western populations, while Indian cases demonstrate a differing trends. These population-specific differences highlight the necessity for detailed Indian studies to strengthen early detection, surgical planning, and recurrence prevention. So the conclusion from my study is that basal cell carcinoma in eyelids can present even without classical clinical features. Suspicious lesions need meticulous follow-up and biopsy to confirm the diagnosis, and good functional outcome and disease-free survival is possible with appropriate surgical techniques and reconstruction. These are my references. Thank you.
Nice study. I would suggest that you can make 3 groups based upon the size of the lesion, like less than 4 mm, 4 to 6 mm, and more than 6 mm, and compare between the groups the histopathological features, the radiological features, invasion, rate of recurrence. So then it will be more fruitful. It's a good observational study. And how did you achieve the intraoperative margin clearance?
With frozen session.
You did frozen section?
Yes, ma'am.
Okay.
Those cases with recurrences, was a PET CT done, a CT PET done before?
Yes, ma'am. Not PET CT, MRI orbit was done.
Pointed out, you are trying to analyze it as a single group, no? Depending on some variables like size of the lesion or the location of the lesion or other things, as you said, like recurrent cases separately, incident cases separately. Like that, you make subgroups and study. It looks very good, and if you do this, then you will get a lot of data.
Okay, sir.
Then that will bring some light into how these are diagnosed and treated.
Okay. Thank you, sir.